Welcome to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and we discuss a broad range of issues related to pets on this show. Tonight, I'd like to talk about the focus on animal nutrition and therapeutic diets. And Dr. Rogers, will you introduce our special guest, please?
Thank you. I'd like to introduce Dr. Laura Eirmann, who is a veterinarian and a board-certified nutritionist. I think you mostly do small animals.
Correct, yep.
And Dr. Eirmann is an integral part of a healthy team and also a therapeutic team. And so tonight I'd like to discuss the therapeutic diets as well as your interventions and your clinical acumen.
Okay, and if you could review for us, please, your background and how you chose veterinary medicine and also nutrition.
Sure. I think like a lot of veterinarians, I just loved animals as a little kid. I had a dog growing up. I fell in love with him. I wanted to take care of him. So I just got into pets and never changed my mind. So that was vet medicine. I did general practice, dogs and cats, for a number of years. And so many people asked me about diet and nutrition. What should I feed my cat? What's the best food for my dog? That I just really started getting interested in nutrition and decided later on to specialize in it.
Okay, what are the scope and specifics of your clinical practice?
I'm board certified in small animal nutrition, so I work with dogs and cats. And in our practice, I often get referrals from other doctors in the hospital and also from clients that have specific questions about the best way to feed their pet, either to keep them healthy or to help them out if they're not feeling well.
But you also interact with the internists
I do.
and the
Yep.
surgeons to support them in what they do as well.
Right, it's a team approach, and depending on the condition that the animal has, and we'll probably get into that with some examples later on, I may work with our surgeons, I may work with internal medicine, I may work with a cardiologist.
Okay, and what are veterinary and therapeutic diets exactly?
It's a really good question. They are foods, they are not drugs or medications, so they're foods, but they're foods that are designed to help, and I'll say dogs and cats in particular, that have particular needs, particular medical conditions that altering either the amount of a nutrient or a type of nutrient can help in their overall treatment plan.
So why are these diets only available through a veterinarian?
There are a couple of reasons. One main reason is that we want the right diet for the right medical condition. So we want to make sure that the veterinarian has made a diagnosis. If these were available to anybody and the pet owner made a mistake of perhaps the wrong type of bladder stone, they might not be feeding the right diet. So both for that reason, and also in some instances, these diets are manipulated so that they might be right for an animal with that disease condition, but they might not have the right nutrients, say, for a growing puppy or kitten. So we want the veterinarian involved in choosing the diet and mostly monitoring response, making sure that's the right diet for that patient.
Now, are therapeutic diets an alternative to medication?
They're not an alternative. We're very careful that these are not drugs. These are not medications that have been put in food. This is nutrition. So it's not the same as a medication. It should never be used in place of medication, but it's a very important component of the overall treatment plan for animals with certain disease conditions.
Really, it's an adjunct to a healthy therapeutic regimen. So medication may well be part of it, but also the nutritional aspect has to be covered because animals have different nutritional needs with different diseases, but also with different ages. And so we want to make sure that while we're medicating our animals, we're supporting them nutritionally as well as therapeutically with medicines.
Okay. So are there diets for older animals that are not prescription?
Absolutely. So if you go to the pet store, the grocery store, you'll see diets that are marketed for senior animals. And I still strongly recommend that the pet go to the veterinarian as a senior twice a year, at least for evaluation. The veterinarian may choose a special food, for example, if that older dog or cat is slowing down and gaining weight. So they may recommend a senior diet that's lower in calories, for example. If the senior pet has a certain medical condition, they may need a therapeutic diet, or they may just say, perhaps for GI health, I want a diet that you can purchase at the pet store that maybe is a little bit lower in fat than what you're currently feeding, or a little higher in fiber, so that the veterinarian can guide and make the decision of whether it's something that needs to be the therapeutic prescribed diet or whether it's something you could get at the store.
Okay. So what are the alternatives to therapeutic diets that can be made at home?
Some owners do choose to cook for their pets. I always preface that by saying it takes a lot of commitment. A very good, well-designed pet food has a lot of expertise. There are nutritionists that are working in the formulation. There are food scientists that are putting that formula together. So if you want to do it yourself, you want to do it under the guidance of your veterinarian and veterinary nutritionist. So there are actually veterinary nutritionist websites that can help pet owners. So I always say the first step for somebody who has interest in cooking for their pet is have the discussion with your veterinarian to find out if it's right for your dog or cat. And if so, how can you get to that expert to help you?
Okay.
And we talked about older animals, but we can also mention kittens and puppies. And there are nutritional items out there for kittens and puppies. I recently had a case where a puppy came in. It had been on a puppy food and was sore in its joints. And so could you just discuss foods for puppies and kittens and how they might differ than adults or
Sure.
older
Yep.
animals?
So when puppies and kittens are growing, they have the need to consume more calories than in adults. They need more protein. So the protein in these types of diets is typically higher. They also have growing bones, so they need more calcium and phosphorus. Now, the example you're giving is making me think of a large breed growing puppy, such as a retriever or a German shepherd.
Or a pit bull.
Or a pit bull. These guys are really special cases because, for example, let's just take calcium. We all know calcium's good for bones, but too much calcium can lead to skeletal development problems, and so can a calcium deficiency. So you need to work with the veterinarian to make sure it's a diet that's formulated for puppies, and then there are actually diets that are formulated for large breed puppies, and that would be even preferable. More important than anything else for skeletal health, it's feeding to make sure that the puppy doesn't grow too quickly or gain too much weight. So we talk about that as feeding to keep them nice and thin and lean.
And then the other group of dogs that exist that we have to, or dogs, I guess more dogs than cats, are the sporting dogs, the ones that are police dogs, that are working dogs, the huskies, and so they also require some special nutrition.
They do. So they're active working dogs. So compared to a lot of our pets that are probably sleeping while we're at work all day, these guys are working. So these guys may need more calories. They need to have good, strong muscles, so they need the right amount of protein and the right type. And they're athletes, so we're almost thinking about, especially if they're hard-working dogs, about meeting the needs that you might think about for, say, a marathon runner.
Right.
Okay. What are the consequences of feeding only human meals to dogs and to cats?
So a lot of folks love to give human foods or cook for their pets, and some of the biggest challenges that we see really come down to the vitamins and minerals. So we think, oh, dogs love chicken. I'll just feed my dog chicken and rice, for example, is quite common. In fact, a lot of veterinarians will say do that short term for a couple of days if an animal got into the garbage and has an upset stomach. The challenge with that is that none of us would live on chicken and rice alone. It's very deficient in certain nutrients. Typically, people are feeding chicken breast or maybe chicken thigh and white rice. That type of diet is going to be deficient in many nutrients, calcium being a big one for bones, vitamin D. Now, dogs and cats, I was just asked this today in the clinic, dogs and cats can't make vitamin D from the sun like we can. They have to get it in their diet. So if an owner's going to cook for the pet, please talk to your veterinarian, get in touch with veterinary nutritionists, because there are specialized vitamin and mineral powders or supplements that can be added to make those diets complete. That's what we really want to go for, make sure we're meeting all the nutrient needs.
Okay, and Dr. Rogers, if you could take over the questioning at this point for the more detailed.
Sure. Well, I also just want to ask, where can we find out what different ages, different groups of pets? So we have our puppies, our kittens, then we have our active middle-aged dogs, and then we have our older pets. So is there a way that the owner or even the veterinarian can go and find out about what the nutritional needs are of those animals?
There are actually some great websites. There's actually a new website called Pet Nutrition Alliance that is very good. There's also, some of the veterinary schools have excellent resources. A local veterinary college, Tufts, up in Massachusetts, has an excellent nutrition website. So for anybody interested, veterinarian or pet owner, if you were to just Google Tufts Veterinary Nutrition, you'll get to this wonderful website, frequently asked questions about that whole point. But what is this thing that we refer to as life stage nutrition, which typically we'll say, just as you did, puppy, adult, senior. Then within adults, we start thinking about active adults, or maybe a little bit more of a couch potato adult to passive. And so some of these websites, like Pet Nutrition Alliance, for example, actually has a calculator to help you estimate how many calories an individual pet might need. And that's actually meant for veterinarians and veterinary technicians to use.
Right. And so we also look at both dogs and cats, and we see there are differences. We have our couch potato basset hounds, and we have our active Jack Russells. Are there differences in needs, nutritional needs for those groups based on their breed?
First, I'll start with species, since you brought it up.
Okay.
There are very, very big, very interesting nutrient differences between dogs and cats. Cats, as we all know, are obligate carnivores. They eat prey. They eat living animal, right? They're not vegetarians. They eat meat. So they actually need more protein. They need specific nutrients that their bodies can make. There's this amino acid called taurine that veterinarians all learn about in vet school. So we can't feed a cat dog food and not expect problems over time. Now, if we subset dogs and we go, well, they actually are omnivores. They can eat both meat and vegetable, so we can put diets together that use both those types of ingredients. But amongst the breeds, there are some very interesting differences. Part of what we alluded to earlier, these large breed puppies, when they're growing, have some specific requirements. There are certain breeds that are predisposed to gaining weight more easily than others. Beagles like to gain weight.
Veterinarians like to gain weight.
So we might have to feed them fewer calories per pound of body weight. So we have some pretty interesting differences there. We have some unique breeds that we like to think about nutrition, and we may get to this later if we talk about bladder stones. Certain breeds just metabolize nutrients differently than others, and they're prone. So we often talk about Dalmatians forming a type of bladder stone called a urate. So there are actually special diets for those dogs that form those kind of stones. So yeah, we do think about the breed a lot and think about what are they prone to getting and how might their nutrient needs differ.
So that's really interesting, but we only have a couple of seconds left. So what do you think overall of nutrition for the general practitioner? Can we handle it, or should we always refer to you?
Yeah, it's based on physiology and medicine, and I encourage folks to start with your veterinarian. I often hear vets say, I didn't get enough nutrition, but you got plenty of physiology. I like the complicated, hard ones that have 3 or 4 different conditions. Yeah. So yes, always start with your vet. They will handle 90% of them.
Yeah. And I just want to say that as a general practitioner, I read a lot, but I also refer to Dr. Eirmann, because there are things I just don't know and I can't figure out. So I'll call her and I'll get her input, and I'll work with my clients.
Okay. Well, we have to take a break, and then we'll be right back after the break to finish this conversation. This is You and Your Pets. I'm Jim Horton. We'll be right back.
After 17 years working as a mason, Mike was laid off. I met him when he came into the library looking for help. He found a job opening, but the application was only online. Mike said he'd spent his entire life around tools, but had never used a computer. I showed him how, and he ended up applying for numerous jobs online. I saw Mike the other day. His new computer skills paid off. He's working again.
New Jersey libraries are transforming lives. Tell us your story.
We're back with Dr. Ernest Rogers and You and Your Pets, and we are discussing pet nutrition this evening. And Dr. Rogers, would you take it over from this point?
Well, thank you. Thank you very much. A question came up as we went off the air, and the question was, we were talking about young dogs, middle-aged dogs, and older dogs, and we really didn't mention the ages, and I'm sure it's different for every breed, but in general, what would you consider a young dog, young kitten, and where the the variation occur when they are now middle-aged, and then again when they're older, senior.
So if we start with puppy and kitten, when should I switch from a puppy or kitten diet to an adult diet? The medical answer for a veterinarian is when the skeleton is fully formed, so skeletal maturity. And what we'll all learn in vet school for cats, that happens at about a year of age. So 12 months is about the right time for a cat to switch from a kitten over to an adult diet. Dogs get a little bit more complicated because we have this range in size, and as many of you probably know, young puppies, small breed puppies, reach maturity at a younger age. So I often say to folks, by the time your Chihuahua is 6 to 8 months, you can probably start switching them over to an adult diet. Start getting into beagles, you're probably talking, again, more about a year or so. Now we start getting into the retrievers, 12 to 14 months. You get into the giant guys like the Great Danes, the Newfoundlands. Those guys, often we can still consider puppies and still growing and maturing until about a year and a half or
Right,
sometimes
18
2
months,
years.
right,
Yeah,
exactly.
18. And that's about when I change their diet.
Right. And then middle age?
Middle age, you're starting to think about older. Well, boy, that's like people, right? We have some individuals who are 60 years old and are like 30-year-olds, and then we have some 40-year-olds that are like 80-year-olds. So it's individual. But again, general rule of thumb, when should I start thinking about a senior diet? A lot of us probably were told the magic number of 7 years of age. However, that also depends on species or breed size, because the little guys often live a lot longer. So you may have a Chihuahua who's really not senior or has a lot of nutritional changes until about 12 months or 14 years, and then your giant breed, you may be starting to think about a senior diet in a Great Dane closer to about 5 or 6.
5 or 6, yeah. And then these animals are all assessed by a veterinarian. Sometimes we as general practitioners will take blood work and find different issues. I like to take blood work around 5 and 6 and make as a baseline, and then move on from there and see how the animal progresses. As I tell most of my clients, with a lot of diseases that can be treated by nutrition, you aren't going to cure them. You're going to slow them down. So
Absolutely.
kidney disease,
Great example.
crystals. We really want to slow down the diet, slow down the progression of the disease by using nutritional aids rather than putting the animal on medication.
Absolutely, and that's how I look at it as well. So for example, if an animal gets a bladder stone, I'm not sure the diet will ever prevent it from coming back. The Dalmatian example, you're still a Dalmatian. I haven't changed that with the diet. But if I can slow down the time till the stone comes back, or get it small enough that maybe we can do something else about it, a little less invasive, then that's a success.
Right. So we can move on now. That was an excellent question from the field. But let's discuss specific diseases and nutritional intervention. I think the big disease that I see in a lot of older animals, particularly cats, not so much dogs, but particularly cats, is diabetes mellitus or sugar diabetes. It's the same in humans as it is in animals, in that we tend to see an increase in urination, an increase in drinking, and they present to us for those two things. And when we check, we find out that the blood levels of sugar are very high, and even the urine levels of sugar can be high. So we address those issues often with insulin, but there has to be a nutritional component to help, to support.
Yes, absolutely. And there's an interesting, well, first of all, before we even get there, can we help prevent it? And without a doubt, just like in humans with type 2 diabetes, particularly cats, if we can prevent them from becoming overweight or obese, we can hopefully prevent diabetes from happening. So before we even get there, always trying to keep dogs and cats lean is excellent for overall health, particularly for diabetic cats. Well, let's say that the patient is already diabetic. Is there something we can do in nutrition? Absolutely, and it is concurrent with insulin, and there is a species difference. So cats are carnivores. Cats do excellent as diabetics if they go on a very low carbohydrate diet. So there are some of these veterinary diets or therapeutic diets that are specially formulated to be very low in carbohydrate, because carbohydrate is a precursor to sugar. And these diets instead are very high in protein. So for the cat, that's an excellent option. Dogs are a little bit different. For diabetic dogs, we're often thinking about high fiber type diets. So there's a really interesting species difference of the type of diet you might prescribe for a cat versus a dog. End result is the same. We're trying to help the animal manage the blood sugar in addition to managing it with the insulin that their body is no longer making enough of.
And so what's interesting to me is that there are multiple therapeutic diets, and in full disclosure, Dr. Eirmann actually works for a major pet food company, we won't mention, but works for a major pet food company. And the differences between diabetic diet with one company versus diabetic diet with another company, could we expect to see differences in response based on just the nature of the company putting together the diet? And
Well, I love that there are different options across different companies, because before we even get to, what you're describing as one better or more effective,
right.
we all have taste preferences. So a great example is actually if animals aren't feeling so great, either they have, stomach upset, or maybe they have kidney disease, diseases where animals sometimes don't want to eat. It's wonderful to have more than one option. And that's what I do in my clinical practice. I give people, I send them home with choices. Your pet might like company A, diet, and he may eat it for a month, and then he wants company B. The next patient might want B over A. So number one, the diet's not going to help if they won't eat it.
Right,
so
right,
companies
right.
invest a lot in making these foods taste very good, but there's going to be differences. In terms of efficacy, they all work very well, to be honest, but that's the fun part of my job, because a lot of what I deal with isn't just the diabetic. It's the diabetic who has 2 or 3 other conditions. So I might be looking for the company that makes the diet that not only has low carb, but maybe also has a certain sodium level, because that patient has very significant heart disease. And that's where a clinical nutritionist can really help a general practitioner, because part of my job, what I don't know are the things you know. Everything about every drug for different medical conditions, we can't all know it, everything.
can't know
So we have to work together. So my job is to know these products and know where they fit.
Right. And so the next disease that may be equally as common is diarrhea and vomiting. If I see another diarrhea in dog or vomiting cat, and sometimes it's not vomiting, I just want to point out sometimes it's regurgitation because the animals eat too quickly. My solution to that is to spread it over a plate so that they can't grab mouthfuls like they would in a bowl. And that usually works. But we still see vomiting and diarrhea in dogs and cats. And so there must be nutritional interventions that can work.
Right, absolutely. And to be honest, the more we know the actual cause, the better I can help with the dietary recommendation. But there's some great general principles. Where most of us start with an animal that has been vomiting or diarrhea is to do something highly digestible. Just like if we have the flu, you want to just have something very bland. And so, a very highly digestible diet that's not too rich, which to a nutritionist means isn't too high in fat. So a very simple diet. A very highly digestible, low or moderate fat diet. That works for the vast majority of cases. That would be a perfect example of my dog got into the garbage and has an upset stomach. There are other diseases where actually the diarrhea responds to a higher fiber. Just like in humans, you'll eat a bran cereal or something like that to be regular. So it's sort of the same concept. So again, the veterinarian, through their history, their physical exam, is going to kind of determine what kind of diarrhea or underlying conditions going on, and then pick the appropriate diet. Then, of course, some animals, it's just maybe almost a allergic or allergy type reaction to the food, and then there are certain diets for that as well.
And so we do see gastrointestinal disease, and we do have to diagnose it. So what I do as a general practitioner is take blood, I will look at it, and then I'll consult with you or consult a book, or maybe sometimes know off the top of my head what to do. And it's important that we use therapeutics as well. I use a lot of probiotics.
Yep.
In animals with diarrhea and gastrointestinal disease.
Right. So probiotics are the good bugs, the beneficial bacteria. If you eat certain yogurts, you might be eating them for the active yogurt culture. So there are probiotics specifically designed for dogs and cats, and they do research. They look at different causes of diarrhea, and they are absolutely very effective.
Right. And then another concern that I have is crystals in the urine, and we've talked about this. I have to say at this point that Mr. Horton's dog, who passed recently, had crystals in the urine, and we had him on a diet.
Had him on a special diet.
Had him on a special diet for calcium oxalate crystals. and it seemed to work, but it didn't stop, as you say. It slows it down, but doesn't stop it.
Especially that particular kind, calcium oxalate, are very challenging nutritionally. There are other types. A really good example, quite common in cats, are a type of stone called struvite. That's very interesting because with the right diet, we can actually make those stones smaller or potentially dissolve them. Again, I rely on you. If you're asking me what diet, the first thing I'm going to say, well, what kind of crystal are you seeing?
Right.
How many are you seeing? Is there also an infection going on? Because for some types of stones, if there is a concurrent infection, we have to address that also.
Right. And so then finally, I think the gorilla in the room is food allergies.
Absolutely.
And we see lots of food allergies. I tend to recognize them because the dog, I don't see it too often in cats, although I'm sure it occurs. The dog comes in with bad ears, chewing at his feet, and because the food is allergic going in, he may vomit, he may have diarrhea, but because it comes out, he has a little red button for a bum, and we see it at both ends. So there are a number of ways of dealing with this.
And you gave the classic sign. So people, I have seasonal allergies and I sneeze and I rub my eyes. Well, when dogs are allergic, they usually either have GI signs, as you mentioned, diarrhea, or they're itchy. They're licking their feet. Ear infections are very common. They're scooting their little hindies because they're itchy. They're rubbing their faces. So the challenge is that could be food when it's skin. It also could be inhalant. If they have both that and a little bit of soft stool or GI upset, it's more likely food. And so then we have to figure out if that's it or not. The problem is that blood tests for food allergy and skin tests are not very reliable. We have to do what's called a dietary food trial, and it isn't easy. It isn't easy to do at home. I love to give my dog treats and snacks, and when we do a food trial, it's actually a test. So there are special diets that are made for doing food allergy tests, and veterinarians will consult with the clients and say, this is a specialized diet. It's really a test, but it's a test that takes many weeks. For GI signs, for vomiting, diarrhea, typically they'll respond quickly, 2 to 4 weeks. For skin, it can take a lot longer. And it's pretty hard. If you think about people who have peanut allergy, one peanut can set you off. So one dropped, piece of chicken, if that dog is chicken allergic and he snatches it off the floor, if he's really sensitive, he could flare, he could vomit right away, he could get itchy ears. But the diet is the way to do it, to make the diagnosis.
It's tough when you have kids, it's tough when you have
Absolutely.
teenagers. But the bottom line is that, Mr. Horton, I would like to dedicate this show to Max.
Thank you.
And he's been part of my life for 10 or 12 years and part of your life for longer than that. And if there are any questions, please feel free to contact me at maplewoodAH@comcast.net.
Okay. We've run out of time. I want to thank you for watching You and Your Pet with Dr. Ernest Rogers. Thank you for watching.